Hey everyone, Dr. Mike here for Peace for All, and welcome back to the channel. Today, we're diving deep into a topic that's close to my heart, literally. We're talking about angina, a condition that affects millions around the world. Now you might be thinking, angina, what's that? Well, it's basically like your heart sending you a signal, a warning sign that something's not quite right. And trust me, you don't want to ignore these signs. We're going to break down everything you need to know about angina, from the most common symptoms to what you can do to protect yourself and your loved ones. So buckle up, grab a glass of water, and let's get started. Alright, let's talk about the big one, chest pain. This is often the most common and noticeable symptom of angina. Now, when I say chest pain, I'm not just talking about a little twinge. This is a feeling of pressure, tightness, squeezing, or even a burning sensation right in the center of your chest. Imagine someone's got their hand wrapped around your heart, and they're giving it a good squeeze. Not a pleasant feeling, right? This pain can sometimes feel like indigestion or heartburn, which is why it's so important to pay attention to your body and any unusual sensations. If you're experiencing this kind of chest discomfort, especially during physical activity or when you're stressed, don't brush it off. It could be your heart trying to tell you something. Now this pain usually goes away with rest. You sit down, take a breather, and the pain subsides, but don't let that fool you. Even if the pain is temporary, it's crucial to get checked out by a doctor. Remember, early detection is key when it comes to heart health. So, we've talked about chest pain, but here's the thing about angina, it's sneaky. This pain doesn't always stay put. It can radiate like a ripple effect to other parts of your body. Think about it like this. Your heart is connected to a network of nerves, and when something's off with your heart, those nerves can send pain signals to other areas. So where else might you feel angina pain? Well, it can spread to your arms, especially the left arm. You might feel a dull ache or a sharp shooting pain that travels down your arm, but it doesn't stop there. Angina pain can also creep up into your neck, making it feel stiff and sore. And don't forget about your jaw. It might feel tight, like you've been clenching your teeth all day. Even your shoulders and back aren't immune to this radiating pain. You might feel a persistent ache between your shoulder blades or a tightness across your upper back. The key takeaway here is this. Don't just focus on chest pain. If you're experiencing discomfort in any of these areas, especially in conjunction with chest pain, it's crucial to get it checked out. Alright, let's talk about another common symptom of angina that you definitely don't want to ignore, shortness of breath. Now, we all get a little winded sometimes, especially after a workout or climbing a flight of stairs, but when I talk about shortness of breath in the context of angina, it's different. It's like your body's saying, hey, I'm not getting enough oxygen here. You might feel like you can't catch your breath even when you're resting. This happens because when your heart isn't getting enough blood flow due to narrowed arteries, it can't pump oxygen-rich blood to the rest of your body as efficiently. And guess what? Your body needs oxygen to function properly. So, if you find yourself gasping for air, especially during physical activity or when you're lying down, it's time to pay attention. This is your body sending you a clear signal that something's not right. Don't brush it off as just being out of shape or needing to hit the gym more. It could be a sign of something more serious. Remember, your heart and lungs work together, so any shortness of breath, especially when it's new or unusual for you, should be taken seriously. Let's talk numbers for a second because sometimes statistics can be a real wake-up call. Did you know that angina affects millions of people worldwide? That's right, millions. It's a symptom of coronary artery disease, which is the leading cause of death for both men and women globally. That's a scary thought, right? But here's the thing. Knowledge is power. The more you know about angina and the warning signs, the better equipped you are to protect yourself and your loved ones. Coronary artery disease, or CAD for short, is like the silent stalker of the heart. It develops slowly over time as plaque builds up inside the arteries that supply blood to your heart. This plaque is like a sticky, fatty substance that narrows the arteries, making it harder for blood to flow through. And when your heart doesn't get enough blood flow, that's when angina happens. It's like your heart's way of saying, hey, I'm not getting enough fuel here, something's gotta give. So these statistics aren't meant to scare you, but to empower you. Understanding the prevalence of angina and its link to heart disease is the first step towards taking control of your heart health. We've covered some of the most common symptoms of angina like chest pain and shortness of breath. But here's the thing about this condition, it can be sneaky. Sometimes, angina throws you a curveball with symptoms that you might not immediately associate with your heart. So let's shine a light on some of these less obvious but equally important warning signs. First up, nausea. You know that feeling of queasiness in your stomach like you're about to lose your lunch? Well, that can be a sign of angina, especially if it comes on suddenly during physical activity or stress. Then there's fatigue. We all feel tired sometimes, but angina-related fatigue is different. It's like a bone-deep exhaustion that doesn't go away with rest. You might feel drained, even after a good night's sleep. And finally, dizziness. That feeling of lightheadedness, like the room is spinning, can also be a sign of angina. This happens because your heart isn't pumping blood effectively, which can lead to a drop in blood pressure and reduced blood flow to the brain. Now, here's the important part. These symptoms can be caused by a variety of factors, not just angina. But if you're experiencing any of them, especially in combination with other angina symptoms, it's crucial to get checked out by a doctor. Alright, we've talked about the warning signs of angina, but now comes the crucial part. What to do if you or someone you know is experiencing these symptoms. First and foremost, don't wait. I repeat, do not wait. Time is of the essence when it comes to heart health. If you're experiencing chest pain, shortness of breath, or any of the other symptoms we've discussed, call 911 or your local emergency number immediately. I know it can be scary, but trust me, it's better to be safe than sorry. While you're waiting for help to arrive, try to stay calm and relaxed. Loosen any tight clothing and take slow, deep breaths. If you have any prescribed heart medications like nitroglycerin, take them as directed by your doctor. Remember, early diagnosis and treatment are key to preventing more serious heart issues. Angina is a warning sign, a wake-up call from your heart. Don't ignore it. Take action, seek medical attention, and get the help you need to keep your heart healthy and strong. I've invited a leading cardiologist, Dr. Cardiologist's name, to share their expertise on managing angina and protecting your heart health. Dr. Cardiologist's name. Angina is a serious condition, but it's manageable with the right approach. It's your heart's way of telling you that it needs help. Regular checkups with your doctor are crucial for monitoring your heart health and detecting any potential problems early on. A healthy lifestyle is paramount. That means eating a balanced diet that's low in saturated and trans fats, exercising regularly, maintaining a healthy weight, and not smoking. Medications play a vital role in managing angina and preventing heart attacks. Your doctor may prescribe medications to lower your blood pressure, reduce cholesterol levels, and improve blood flow to your heart. Remember, angina is a chronic condition, but it doesn't have to control your life. By working closely with your healthcare provider, making healthy lifestyle choices, and taking your medications as prescribed, you can live a full and active life. That was a lot of information, but I hope you found it helpful. Remember, recognizing the warning signs of angina can truly save lives. Stay informed, be proactive about your heart health, and don't hesitate to seek medical attention if you experience any unusual symptoms. Thanks for watching, and don't forget to like, share, and subscribe for more health tips. And as always, stay happy and healthy.